Thank you so much for providing me this opportunity. Today, I'll be talking about management of stress in patients with ischemic heart disease. I have no disclosures. The role of mental stress in ischemic heart disease is twofold. First, it's a risk factor for coronary artery disease, and it also is a trigger for acute ischemic attacks in patients with established coronary atherosclerosis. During mental stress, there's release of catecholamines that trigger cascades of events that leads to increase in heart rate, increase in contractility, increase in blood pressure, and potentially lead to coronary vasoconstriction, all of which contribute to an increased demand for oxygen for the heart muscle. Now, some of the key points that are important for us to understand is that type A personality, which is often associated with anger and hostility, traits seem to be a predisposing factor for the development of coronary artery disease. Incidence of sudden death and myocardial infarction is significantly higher in the morning hours after awakening when mental stress is higher. Ischemic episodes induced by mental stress are generally silent and less severe than those elicited by exercise test stress. Association of mental stress induced ischemia with adverse outcomes is stronger in men than in women. Now, a lot of you must have heard about broken heart syndrome. It's a real phenomenon. It's also called as Takotsubo cardiomyopathy or stress-induced cardiomyopathy. It's a temporary heart condition that can mimic a heart attack and is triggered by intense physical or emotional stress. While the symptoms can be severe and frightening, most people usually recover within weeks or months with proper treatment. And in rare cases, broken heart syndrome can lead to complications like heart failure, arrhythmia, and even death. So now that we have established that the stress plays a huge role in ischemic heart disease, so what do we do to address this issue? So some of the things that can be considered is cardiac rehabilitation, cognitive behavioral therapy to help people deal better with stress and develop adaptive coping skills. Yoga, it seems like you guys had a yoga session scheduled this morning, which is really good. Um, and mindfulness training. Mindfulness training, there are several ways to do it, like deep breathing exercises, mindful meditation, body scan, mindful eating. And I will go over some of these mindful training exercises, which are very quick, brief, and you guys can use it in your clinic setting to teach the patients. These are very simple exercises that anybody can teach the patients. And then some of you can also utilize in your daily lives because I can understand that the practice of cardiology in Pakistan must be really stressful. So the cardiac rehabilitation has 5 components: regular exercise, eating a healthy diet. Here in US, we usually recommend Mediterranean diet, which is high in legumes, olive oil, vegetables, fruits, and fish, and low in fat. And reduce stress, whatever helps people achieve relaxation, whether it's recreational activity, music, or mindfulness techniques. Optimization of the medical therapy, like the previous speaker was talking about hypertension being one of the highest risk factor for cardiac illness. So making sure that we address the risk factors like hypertension, diabetes, obesity, hyperlipidemias, and provide optimal medical therapy for those, and smoking cessations. These are the 5 components of cardiac rehabilitation. Then some of the mindfulness techniques that can be used or taught to the patients in the office setting. One of them includes box breathing technique. And this technique, what we do is that we teach the patients to take a deep inhale, and they inhale at the count of 5. Then we ask them to hold it at the count of 5, then exhale at the count of 5, then hold again at the count of 5, and keep on going, inhaling, holding, exhaling and holding and repeating over and over until the patient feels calmer and feels less stressed or less anxious. Another technique, what we also called as either 1, 2, 3, 4, 5 technique or grounding technique, is helping the patient uh, 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 calm themselves by thinking about, naming the five things that they see around them. So if they're in the office setting, they can name the things like table, chair, door, pen, clock, whatever five things they see in the office, and then five things that they can feel, three things that they can hear, two things that they can smell, and one thing that they can taste. So when they are focusing on things around them, they're able to de-stress and kind of ground themselves and feel less stressed. So this is really helpful technique, and it can be taught in an office setting. Another thing that sometimes we encourage patients to practice mindfulness eating. So we ask them to listen to their body and eat when they're feeling hungry and stop eating when they're full. We encourage them to drink 8 glasses of water. We encourage them to focus on eating. So when they are eating, try not to multitask, like not to watch TV or be on their cell phone, and then take their time to eat meals. Make sure that they have healthy sources of meals, and then savor their food. Think about the texture of the food. Think about the aroma. Think about the flavors of the food, and savor their food. Another thing that we sometimes teach patients is called as body scan meditation, in which we ask the patient to sit in a comfortable position, whether it can be a yoga pose or it can be sitting on a chair or laying down in bed, but just having some kind of comfortable posture. And then we ask them to close their eyes and focus on their breathing. And then we ask them to become aware of a specific part of the body. Sometimes it's helpful if you start from the head and go down to the toes. So if you're thinking about the head, we ask them to notice what kind of sensations they're having. Are they feeling some kind of tension in their head? Are they feeling any kind of headache? And then we ask them to imagine their tension decreasing with each breath. And then we ask them to continue to focus on breath and then focus on releasing the tension with each breath. And once they feel calm and then their tension is released, then we ask them to focus onto the next part of the body and the next part of the body, and continue to do that until they progress from head to toe, and then they feel calmer and they are in a relaxed state. So there are various kind of meditations available that the patients can do, or small techniques that they can use in daily life to reduce their overall stress. So the take-home points are: screen for stress actively, um, educate the patient, inform them about the link between the stress and the cardiac events, especially the silent ischemia, integrate mind body techniques into your comprehensive management plans. These mind body techniques can be anything: mindful meditation, breathing exercises, whatever, listening to music, doing yoga, going out for a walk, whatever helps patient ground themselves, that would be helpful. And then collaborate with multidisciplinary teams. Like one of the previous speakers was talking about the higher rate of anxiety and depression in patients with cardiac illness, or anxiety and depression leading to coronary artery disease. So sometimes collaboration with psychiatry, getting them onto the right antidepressants or anti-anxiety medication or therapy might be helpful. And then personalize the interventions tailored to the patient's specific coping styles. And then, like the previous speaker was talking about, the low health literacy is a huge risk factor in patients being non-compliant with hypertensive medications. So just tailoring the management techniques based upon their health literacy, their coping styles, and their individual patient needs. These are my references, and I'm open to any questions if there are any. Thank you so much.